Whether you are pregnant or planning to get pregnant, you will want to give your baby a healthy start. A great place to begin is at the antenatal clinic. These clinics can be accessed at all medical stations and health centers in Grenada. There, women receive medical care throughout their pregnancy and even after delivery. At the antenatal clinic, any potential problems can be detected early and even possibly prevented. Suitable health recommendations are made to expecting mothers, and they are directed to appropriate specialists and the hospital if necessary.
Antenatal clinic or prenatal clinic, that is where we see all pregnant mothers, right? So we do all that is necessary for them. When they come, they get their weight checked, their blood pressure monitor, blood sugar would be monitored. We check urine to make sure that they're not spilling any glucose protein in the urine, which would tell us if they want to come down with a diabetes or high blood pressure in the pregnancy. We also do the total physical examination to monitor the baby, the fetal heart, and everything that needs to be done for a pregnant woman. We give them the supplements that they can take at home to maintain the iron level, and in case they need to be followed up by the obstetrician, they would be referred. So if we have any cases that is not normal, like they have any problems, diabetes, high blood pressure, or any illness, we would want to refer them on to the obstetrician.
Pregnant women should make use of the antenatal clinics. They are strongly advised to book early and attend consistently throughout their pregnancy.
It's really important that mothers come to the antenatal clinic. And I must say also that we encourage that mothers visit the clinic at the first sign of the missed period. So you miss your period, you should not wait and then say, okay, I'm going to wait until I'm 4 or 5 months. As you miss your period, you should seek antenatal care. And we advocate within the first 12 weeks of the pregnancy. So the first trimester, you should see a medical practitioner, whether it's a midwife or obstetrician. For the normal pregnancy, we see you every 4 weeks up to the 28th week of pregnancy. Then every 2 weeks up to the 36th week, and every week until delivery.
At the prenatal clinic, women are also informed about proper nutrition, exercise, and vitamin intake.
Pregnant women should eat well, or as we say, eat sufficient of the right kinds of food, that which would accommodate or would facilitate the growth of the baby in the womb. It is also necessary that you eat well for making of breast milk and just for the woman to keep her body healthy. You should eat a nutritionally adequate meal, or some persons would say out there a balanced meal. That simply means eating a mixture of foods from the 6 food groups. So you have your staples, which would be your starchy foods and so, your legumes or your dry peas and beans and nuts, your vegetables, your foods from animals, your fruits, and a little fat. Some of the foods that women should pay attention to when they're pregnant, things like having iron-rich foods. For example, all of your red meat, your dry peas and beans and nuts would also provide some iron. Your dark green leafy vegetables like your callaloo and spinach, they would also give you some iron. Iron helps with with the production of hemoglobin, which helps to carry the oxygen to all body tissues and also for making the red blood cells. Your calcium-rich foods, which would facilitate healthy bones and teeth. You also have that vitamin, folic acid, which is very essential during pregnancy. It helps with the proper development of the brain. Callaloo and your spinach give you quite a large amount of folic acid, your beans, and some of your meat too. We from the Food and Nutrition Council would like persons to get all of their nutrients from natural foods. The medical persons would assess the pregnant woman, because whenever they are pregnant, they have to do a blood test, and whatever is lacking, if you find the calcium is low or your iron is low, some supplement would be given, but that doesn't mean to say that she doesn't have to eat sufficient of the right kinds of food. Some of the foods that persons should avoid when they're pregnant, we say any food that would cause discomfort. For example, if the woman has problem, have a nauseated feeling after she would have eaten maybe fried foods or something very sweet, or something that would maybe don't feel right with her, she should avoid that. But there are some foods, for example, high fat foods or fatty foods, she should try and avoid that. That could also cause some discomfort. High sugar intake, high salt, that should be avoided. Alcohol, that should be avoided. Some of your colas and other caffeinated drinks like coffee and tea, they should also look at those things, avoid those things.
In early pregnancy, morning sickness or nausea may be common, and the body will also tend to be tired and need more rest. Being aware of the changes in your body as the baby grows will help you better adjust to your pregnancy.
Nauseated feeling and vomiting, that some persons have difficulty coping with those conditions, but there are some basic things that one can do. You can have maybe your breakfast 15 minutes in bed before getting out of bed. So you get up, you sit up in bed and have your breakfast there and allow it to rest for about 15 minutes, right? And then you can get up slowly. You can also eat some crackers, and the crackers should be eaten without anything else. So you have what you consider to be dry crackers, as we would say. Do not eat and drink at the same time. Avoid fatty foods or fried foods, because all of those things can cause one to, have that discomfort. You have problems of constipation, and that could also be relieved by using sufficient of your fruits and vegetables, your water. You can have about 6 to 10 cups of water per day. Right, and that should help relieve some of the problems. You have your whole grain cereals like your oats and, as I mentioned, barley, your cornmeal and so on. You can have those things. Those would help you to relieve some of the the problems. If there are persons who have problems with some of the gassy foods like cabbage and some of the peas and so on, maybe you can abstain from it during that period. Most times you do have that discomfort, let's say from about during the course of the first 3 months of pregnancy. So eat smaller quantities of those items that are, as we consider to be nutritious. For example, your peas and beans, you need some of them in your bodies, but you need to know some of the things that make you feel uncomfortable. You may not want to abstain from it altogether, but use smaller quantities until you reach in a stage where you can eat, a larger quantity.
A mother and her baby will still require regular medical assessment after delivery. It is important that they then access the postnatal clinic, which is available at medical stations and health centers island-wide. The postnatal clinic covers the 6-week period following birth. The mother's body is closely monitored as the various changes that occurred during pregnancy begin returning to the non-pregnant state.
We do the registration of the baby. So the baby would get registered, have a number in the clinic for his medical records. We then do vaccination for the baby, and we do baby's weight, physical assessment and all of that. And for the mothers now, we do the total physical assessment again, the blood pressure check, the iron check for the hemoglobin level, because now they have a baby. So you want to make sure that they're returning back to the normal stage as possible. So you want to do the physical examination. We do the pap smear or the cancer screen again to make sure that everything is okay. And we also do something called a bimanual. That is to examine the mother to make sure her uterus and everything has gone back to its rightful place after 6 weeks and she's ready to go.
Postnatal clinics also provide women with information to enable them to promote the health and well-being of themselves and their baby, and to recognize and respond to problems.
We also teach postnatal exercises because, for example, remember the abdomen, the muscles there separated to accommodate the uterus. Now we know that some people, they're very conscious of the body of the shaped woman, so we need to teach them postnatal exercise so they can get back their thin waist, the figure and so. So there are a lot of things that we do at the postnatal. Also, we do the examination of the neonate, the infant, and we do a head-to-toe assessment. We check fontanelles to make sure that the posterior one is closed. The anterior would be open probably up to 18 months or more. So these are normal things. We check the reflexes, those that are present, we note. We check the vital signs, temperature, and all that with the reflexes, that the baby is sucking well, the baby is able to step, and all those things. We also check the hearing. Some people use a little bell or they make a little clap sound. So, and also the baby is given that first vaccine. And from there we give them follow-up appointments for the baby to join the child health clinic. And the mother, if there is any problem, we would let her know if she needs to come back or if we need to refer her. And within 6 weeks she should get her pap smear results, and we would inform her, come back. If she needs treatment, she gets it. If we need to refer her to the gynecologist, we'll do that.
Care providers also encourage breastfeeding.
Breastfeeding, as we say, is the best food for your newborn. There is nothing better to feed your newborn than breast milk. And we're saying it's best because it provides all of the nutrients in the correct proportion. It is clean, it is warm and ready to use whenever baby needs it. Breastfeeding saves time and money. Breastfeeding provides protection against infection and other diseases. Breastfeeding is beneficial for the mothers in the case of it helps to reduce excessive bleeding right after delivery. It provides that sort of bonding or closeness between mother and child. It does not cause any allergy reactions. So as we say, once mothers out there get the green light to go ahead and breastfeed, they should do that because them and the babies would really benefit.
The Child Health Clinic is also very important to attend. A variety of child health services are offered, including routine body examinations, health education, counseling, diagnosis and treatment of acute and chronic illness, and immunizations. Immunizations are essential for protecting kids from childhood diseases.
Combination plus the polio. So the child will get that at 6 weeks. They will get the second one between 3.5 months to 4 months, and the third one they should get it. Child should get it at 6 months. So that's the 3 primary dose. Along with that, you give the MMR, measles, mumps, and rubella at 1 year. Okay, after you get that, you say you have completed your primary doses. At 18 months, you give a second MMR, measles, mumps, and rubella. Then you give a booster, first booster, diphtheria, pertussis, tetanus, plus your polio drop. And again at 4, anytime the child reaches 4 years, you can bring him or her in to get the second booster, which is a pediatric DT and a polio. After that, the child gets a third booster between 14 and 15. That time they are at the secondary school level.
Taking the early steps can ensure a safe and a successful pregnancy and a wonderful start to a healthy life for a newborn baby.